The light adjustable lens is what I would consider the most modern or most advanced technology of all the lens options. The way most lenses work, the way we determine the prescription of lens to implant to replace the cataract, is based entirely off of pictures and measurements that we take of the eye before surgery. But unlike any other lens, the light adjustable lens can be modified after the fact, after surgery.
So after you receive the light adjustable lens in the operating room, you'll undergo a series of exams with an optometrist to check your refraction. We then do a series of treatments to the lens to dial in the correct prescription and then lock it in so that you're left with excellent vision at the end.
The light adjustments are typically done here in the office. It's a short procedure where we use a UV light that shines a light on the lens itself to help change its shape and adjust its prescription. And so the treatments themselves are not painful. They can be done pretty quickly. Once we are happy with those fine-tuned adjustments to your lenses, we can lock that in so you can maintain that great vision for the rest of your life.